Atlanta-based Pindrop is on a mission to establish the standard for security, identity, and trust when it comes to the future of voice, particularly across the healthcare sector. Joining me now is Vijay Balasubramaniyan, Pindrop's co-founder and CEO. Vijay, welcome.
Thank you so much for having me, Ashley.
So what are you launching for healthcare organizations?
Yeah, so healthcare organizations, the identity and trust platform there is stuck in a pre-Gen AI world where, a lot of the verification is based on questions that like mother's maiden name or your identifying information. And with a lot of the data breaches, and with Gen AI making it super easy to clone people's voices and videos, that model is stuck. And it's very easy for attackers to compromise those models, so much so that we're seeing 70% of all the fraud that's showing up at healthcare organizations is now AI generated. And so what we're launching is a deepfake detection and a continuous identity platform for healthcare to make sure that identity is back to being trusted.
All right, and what makes healthcare particularly vulnerable to this type of fraud?
Yeah, so what makes healthcare particularly vulnerable is in 2024, there were 289 million Americans whose healthcare records were compromised. So that's 85% of the US population who have their healthcare records breached in a single year. And then you combine that with the fact that Gen AI makes it really easy to impersonate someone. That combination is being used by fraudsters to essentially take over accounts. So they're taking over healthcare accounts, they're changing your benefits, they're stealing your HSAs, your FSAs, and they're moving money around. And so ultimately what we're seeing is these attackers are using AI to create these attacks at scale and take over accounts in increasing fashion.
And Vijay, what are the highest risk moments in a healthcare interaction?
Yeah, so what are the highest risk moments in a healthcare interaction are, access to healthcare records. So your personal healthcare records, your PHI, that's in compromise. What these attackers are also doing is they're changing phone numbers on the account by querying, what does it take to change a phone number? And once they change the phone number, they can bypass any two-factor authentication that you might have. And then ultimately, they're actually going after your money. So lots of people have HSAs and FSAs and life savings accounts. In certain cases, those amounts range from $10,000 all the way to hundreds of thousands of dollars. And so what these attackers are doing is targeting that. And we've seen, for example, payers have found a single coordinated attack going after 18 million in accounts. With another customer, we've seen about 22,000 fraud calls targeting close to 40 million in people's HSAs and FSAs. So it's really meaningful amounts that these attackers are going after, and this is what we're protecting against.
And can you share results from healthcare customers in our last minute together, Vijay?
Yeah, so we have right now at most customers, we're shutting down 90% of this fraud. And so what that's translating to is not only are we shutting down the fraud, we're also making it seamless authentication for the customers. So 91% of the customers are getting authenticated without answering silly questions like mother's maiden name and date of birth. But ultimately what that means is we're shutting down hard losses. We've saved 18 million for one customer, over 12 million for another, over 40 million for a third. So very, very meaningful numbers for a wide variety of customers. But ultimately, by making security and authentication easier for the customer, not adding more friction because of these data breaches.
All right, thank you, Vijay Balasubramaniyan, for joining us.
Thank you so much for having us.